Well, that session was chaired by the Conservative MP, Dr Neil Hudson, who's the only vet in the Commons. We heard from him earlier in the programme during the debate on puppy smuggling. When I spoke to Dr Hudson after the hearing, he told me the committee had been keen to find out about the scale of the shortage in the number of vets.
It is still a very popular and competitive profession, but unfortunately, we are not currently producing enough veterinary surgeons in this country to service the need. And whether that's in companion animal practice, so cats, dogs, and performance animals like horses and pleasure animals like horses, but also in the farm animal setting, research, teaching, public health, we are not producing enough. The other thing that came out loud and clear is that the demand for veterinary surgeons has gone up. And so the pandemic brought that into sharp focus. Many people with their sort of changes of lives actually took on a pet. And actually there was a surging boom in a need for veterinary attention for these animals as well. Lots of people took on a puppy during the pandemic. And so there was a marked increase in the need for veterinary surgeons. The other key point is that we are losing a lot of people from the veterinary profession. That came across loud and clear, that retention in the veterinary profession is something that we need to improve on. And that's something that affects other allied professions in the NHS, doctors, nurses, dentists as well, that the veterinary profession has a significant attrition rate where people are leaving the profession. So that's one of the things we wanted to explore, is what are the stresses and strains that are making people leave? And it's pressures of work, salary potentially as well, but also the mental health pressures that are faced in the profession. This is a stressful job, and there are lots of very difficult situations to deal with, from animal disease outbreaks to distressing situations in clinical practice, and frustrated clients, and lots of different issues.
This session took place just as the competition watchdog announced it was going to start a formal investigation into concerns that pet owners may be paying too much for veterinary care. The Competition and Markets Authority said 80% of the vet practices it checked had no pricing information online, even for the most basic services. The British Veterinary Association said vets were fundamentally motivated by animal welfare. Neil Hudson told me the witnesses in front of the committee had agreed there was a need to reform the legislation regulating the profession.
And the message that came loud and clear to me, which was new, was that if we address that legislation, a lot of the other issues facing the veterinary profession and team vet will be addressed indirectly, from animal health and welfare, from practice regulation. And so I think the CMA's review was quite timely in that sense, because that was one of their take-home messages, that the regulatory framework is outdated for the veterinary profession. So I think that was one of the real strong take-home messages, is that reform of legislation is needed. And as one of the witnesses, Stuart Reid, said, it can't come soon enough.
So that puts the ball very much in your court, or in the court of MPs and lawmakers.
Absolutely. And we're in a general election year. And as one of the witnesses, Malcolm Morley from the BVA, said, he would like to see, and I think this is a sensible suggestion, all the major political parties to have something in their manifesto to say that they will address this legislation moving forward. Animal health and welfare is something that is not that controversial in terms of partisan party politics. So I think caring about animals and their welfare and the implications for human health is something that can unite us in humanity. So I don't think it's controversial for both Labour and the Conservatives to be addressing this. Whoever forms the next government, this is something that needs to be high up in the in tray.
Dr Neil Hudson.